It's my absolute pleasure to welcome you all here today to this ATS webinar where we will be speaking about new guideline addressing caring for older adults in the ICU. My name is Bram Rochwerg. I'm an adult intensivist based at McMaster University in Hamilton, Ontario, Canada. I also happen to be on service right now, hiding in a room right off the ICU. So if there's a couple of knocks or I get interrupted, I will apologize in advance. Super excited to be doing today's webinar along with the co-chairs for this guideline. There was three of us that worked as co-chairs for a different society, but still really excited to share with the results. And maybe the co-chairs will introduce themselves. We're going to take turns speaking, the three of us, and the co-chairs can introduce themselves maybe as their talks come up. But really excited to be here along with Dr. Lauren Ferrante from Yale and Dr. Nate Brummel from The Ohio State University. Again, both can introduce themselves as we go. And so the plan for today, I think we have an hour. I'll start talking about the guideline. I'm going to spend about 15 minutes talking about guideline methodology and how we make trustworthy guidelines. Hopefully that's an instructive behind the scenes look and will be helpful to demonstrate the rigor that went into these. Lauren's going to take over from there for the next 15 minutes, talk a little bit about the guidelines and the recommendations that we made within the guidelines. Nate will have the next 15 minutes to talk about, fine, all well and good. This is the recommendations we made, but how can we do better in the future in terms of incorporating older adults into critical care RCTs? And then we plan for 15 minutes 15 minutes at the end for questions. Folks, again, I won't take long. I could talk about guideline methodology. I mean, I'm an intensivist and care about caring for older adults in the ICU. I could talk about methodology for hours and hours on end. And so the struggle here will be fitting this within a 10 or 15-minute talk, but I promise I will do my best to do so and get across to you the rigor, again, that we took in crafting these guidelines. No real disclosures other than to mention I'm a member of the GRADE working group, worked on a number of clinical practice guidelines, including co-chairing this SCCM guideline, caring for older adults in the ICU, no financial conflicts of interest. The old way of doing guidelines, and when I say old way, it's actually not that long ago. We're talking about, 1990s, 2000s, maybe even into the 2010s. Often was to get a group of experts in a room around a table and they would provide recommendations because that's the way they always did things and that's the way everybody else. The group of men tended to be the group of experts were men, white-haired men, and there's important concerns here around diversity and this sort of thing. And so I'd say that things really changed with this seminal production of clinical practice guidelines we can trust in 2011, and it laid out some important tenets for producing trustworthy clinical practice guidelines. Conflict of interest management, in terms of thinking about conflict of interest from the guideline panel itself, the role of industry in guideline panels, ensuring that not only from a conflict perspective, but that the panel was representative. I told you in the past, it tended to be a group of white-haired older men that were around the table, but recognizing that we need diversity in disciplines, diversity in career stage, diversity in sex and gender, and diversity in including patient partners and nurses and respiratory therapists and APPs and pharmacists and physios, and ensuring that, again, a diversity of perspectives. Coming up with questions ahead of time, ensuring that each of the questions had a systematic review, meta-analysis to inform them, sort of summarizing the best evidence for each question, an explicit process for rating the quality of certainty of evidence. When we come up with recommendations, and we'll talk about this a little bit more, it's not just the evidence that goes into crafting recommendations, but other considerations as well. And ultimately, that we report guidelines using a transparent process. I'm going to jump through this slide. This is sort of a famous slide that shows the entire process, but I think better to go through things one step at a time. And the first step when we're doing a clinical practice guideline, and what we did for this project was we had to come up with the questions. And when we come up with the questions, we use the PICO format that hopefully will be familiar to most. We think about explicitly delineating the patients that the question is going to refer to, what the intervention is that we're looking at, what the comparator is, and what are the important outcomes in terms of driving this recommendation.
View this full video at atsnow.thoracic.org.